Tuberculosis is an infectious disease that has been with us for the longest time possible. As much as a vaccine is available, as well as medication that leads to cure from TB, it still remains a global threat. So TB is a bacterial infection that comes about as a result of a bacteria called Mycobacterium tuberculosis. Commonly, we know it to mostly affect the lungs, but TB can affect anywhere else in the body with the exception of the hair, the teeth, and the nails. So yes, it can be in the heart, in the brain, in the intestines, in the bones, in the spine, everywhere. So the common signs and symptoms of TB are weight loss, night sweats, and if it is in the lung, most of the time there is cough and a production of sputum that can be bloody, and it is cough that is more than 2 weeks. The diagnosis for TB, if it is in the lungs, it is made by testing the sputum that comes out to check whether there is TB mycobacterium there, of course, in addition to doing some bits of images. If this TB is elsewhere, more often than not, you're going to get site-specific samples. So if it is in the lymph nodes, some bit of the lymph node. In the pleura is a space outside the lung. So if there is fluid that has accumulated there as a result of TB affecting around the lungs, the fluid is taken and then it is tested for TB. If it is in the brain, of course, you're going to get the spinal fluid for the same. So good thing about TB is that it is curable, and the standard regimen is normally 6 months, apart from patients who have TB in the bones, TB in the brain, and those who have resistance, it might take a little bit longer. For people who have lived or have been in contact with people with a chronic cough, or people who are being managed for TB, as much as you may not be showing the overt symptoms, it is important that you go get tested. And if especially that person is living in the same house as you, there is normally preventive treatment for TB that is given once it's been verified that you are not yet infected with the disease. So TB, as much as it is a scare to many of us, it is a very, very curable disease. And to those of us that are surrounded by people who may be undergoing treatment for the same, or even nursing the complications of tuberculosis because there are, let us extend some love and grace.